Good evening, everyone. Thank you for joining our program. We are giving persons just 5 more minutes to log on, so we will begin promptly at 6:15. We will give persons 5 more minutes. Thank you for your patience. Okay, it is now 6:15 p.m. We are going to go right into it. Good evening again, ladies and gentlemen. Thank you for joining another interesting session of our meditation forum. Now, this evening we have a very special presenter. He is the former SMO at Cornwall Regional Hospital. He is currently the clinical coordinator at said hospital, and he will be talking to us about all things men. We will be having man talk. We urged persons to get the men to log on, or bring a man with them, or but the ladies are also welcomed on this platform, because we have our brothers, our uncles, fathers, sons, so the information will be useful. So thank you very much for joining, everyone. Thank you for joining, Dr. Fray. Thank you for accepting the invite to come and talk to us. So I'm going to go ahead and hand over to you at this time.
Thank you, Mrs. Gill. I mean, it's a pleasure to be here. But when I look at the topic, men's meditation, I see only women. I don't know, Blaine's Galaxy, is that a male? I'm looking at our participant here.
Not sure. Blaine's Galaxy?
Yeah.
Want to say who you are?
A70. So I'm seeing, I'm the only male here.
I must say, we are also live on Facebook, Dr. Fray. So okay, some persons do not have access to Zoom, or Facebook is better for them. So we are live on Facebook.
So this is a men's meditation then.
Men talk.
Men talk.
Yes.
All right. All right. Good evening, everyone. As I said before, it's a pleasure to be here. And we are here to have men's talk. When I look at it from a broad sense, what is the most important thing that men would want to talk about? And I thought it would be a situation where I would have some lively discussion, Ms. Keel, but I suppose I would just go ahead and talk, right? Because I'm not seeing anybody talking back to me. Is that correct?
We'll see how it goes. Hopefully the audience will open up, because we'd love for it to be interactive. So love for the audience to open up as well.
The first thing I want to talk about with men, and this is just from observation, working with men. I mean, this happens to everybody. But I noticed that a lot of men have this issue of anger. And anger sometimes is dangerous, because, you know, when you have a burst of anger about a situation, you realize that probably, you know, if you were just a bit calmer, the situation would be solved. So I want to talk to men. My first little impression here is, how do we control anger? Now, when you look at our physiology and our makeup, it would appear as if the physiology, in a sense, works in a way to produce anger. But we, as, you know, human beings, we have to learn to control what we do, control our speech. And the way we are going to be able to do that is really, it requires, well, I mean, it's a big topic. I could talk from the business of your upbringing to where you are. And we are not going to go into that, because we are all big men now. We are going to work from where we are. So right at this point in time, if you're having an anger problem, I'm sure you might be asking yourself, how I'm going to be able to handle this issue? And the way to handle this issue is best to learn now to be not too impulsive, because that's what it is. That's what I mean, by saying, if you look at it from a physiological perspective, it looks like it's impulsive. Because once you hear something and you see an action, what do you think your body response is going to be? Well, I'll tell you from the physiologic perspective. Your adrenal gland is going to liberate some what we call catecholamines. And these catecholamines, they have a purpose. They are very useful catecholamines that are useful in, to put it simple, when we learn third form biology, we talk about flight and fight response. And really, it's designed to help us from that perspective. But also, it is important to help us to have some amount of creative thinking. In fact, it is said that if you are going to do an exam and you have mild anxiety, you'll probably do much better in the exam than if you never had any anxiety at all. It's like the whole physiology of your body is enhanced and facilitated by having a mild type of anxiety, which is mediated through that little hormones that I'm telling you about, the catecholamines. And also, if you want to look at it from a more detailed perspective, if your adrenal gland is not working and you have an illness that requires an operation, the recovery of the operation weighs heavily on the adrenal function, because the adrenal functions, hormones that are mediated, helps in the whole business of the healing process from the operation itself, and if you are injured. So all of those aspects of it are beneficial and are useful for our well-being and for recovery. But when it becomes pathological is when really we cannot control it. And people get very impulsive. There are some people you just have to say something and boom, they fly off on a angle. And they'll say things, and you see it among one of the aspect of it that is affected most is men's relationship. And I'm not saying that doesn't happen with women as well, but I think to a lesser extent, it's predominantly in men. And you find that when they get into that anger rage, they'll take it out on their spouse, they'll take it out on their children. So what I want to share with you this evening really is, how can we understand anger and learn to deal with anger? The first aspect of it I've dealt with to tell you that it's your whole physiology, and how you're going to control it is now going to be a learned response. I'm going to be very, very honest with you. I remember as a youngster, I used to get angry very easily. And I'm going to tell you why I get angry very easily. Because, I mean, going to school, I thought I was brilliant. Yeah, this was my thinking. And I could not tolerate any type of any activity that don't show any amount of, academia and clear, intelligent thinking. And I was short-tempered, with anybody who cannot think, I would say, along my line. And I remember that continues right through high school. And I remember going to high school, there was a tendency that, I wouldn't talk to students who were probably below 70 average, because I would say they are not up to my standard. I will move along the crowd with the 80s and the 90s. And that went on right on to university. And when I look back on it, I really thought, that was a terrible way to have one could have lived their life. And then finally graduate from university, it was still there. I remember, as an intern, I would be a little short if you don't do the thing right, or etc., etc. So you're aiming all the time to have a perfectionist state. And if you're not getting it, it generates anger. And watch this, you are going to laugh now, and the women are going to be happy for this. When I get married now, I was very lucky. I married a woman who was as calm as, I don't know if there's any descriptive word that talk about calmness. And you know, when I watch her calmness, I start to admire how calm she was. And I wonder how she did it. So guess what I start to do? I start to internalize her. So one of the first thing towards dealing with anger is to find somebody who you can internalize, and you're going to say to yourself, I want to be able to control my anger just like how that person controls their anger. So that is a very, very important step. And when you start to internalize that now, you start to look at yourself. And when you start to look at yourself, you realize, to be honest, how horrible you are. Honestly, when I look back at those days of what I, was then to what I believe I'm here now in terms of calmness, although sometimes, it might burst out, but you realize that it was terrible. And years later, I said to my wife, but you knew I had an anger problem initially. How could you tolerate somebody like that? He said, no, 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 no. What you have to do, learn and to culture the person so that they can get into. So when you hear people talk about, it has to do with your upbringing, it has to do with your genetics, I'm sure that plays a major component, but it's important that you can learn to control it. And what I have been doing now is learning to control it. And I realized that what it did, it was something good for my health. Every time you have a spurt of anger of some sort, just burst it out. I'm going to challenge you. Ask yourself after it calms down, ask yourself how your body feels. You feel a little nervous. Your body just don't feel right. And I can assure you, if you were to check your blood pressure after one of those anger bouts, you'll be surprised to see where your blood pressure has reached. And a lot of people who end up with having a cerebrovascular accident, which is a stroke, they will tell you, so one of the antecedent thing, the thing before having that stroke, they were on a stress. They'll use the word stress. But I know a lady, she got so angry with the helper not doing something good. And she, in fact, the layman would say she blew her top, and she did blow her top because immediately after that, she had a cerebrovascular accident, which left her hemiplegic, and that was for life. So you want to see somebody who you can internalize, you want to understand what is going on in your body, and then you want to learn some response. And the best way to learn some response is from somebody who can understand you. And I remember my wife pointed out something to me that stays with me forever. And every time I have a anger burst, I remember that verse. And she used this verse, and she said, she went and quoted something from Proverbs, which said, anger resteth in the bosom of a fool. And she said, but you're not a fool, you're an educated man. And the Bible is saying that anger resteth in the bosom of a fool. So I want men to learn that little verse. And just before you, and it's going to take some time. I'm not going to tell you that as soon as we finish this lecture, then you're going to end up be a perfect gentleman that you won't be able to have bursts of anger. It's going to be working at it, learning to rehearse certain things. And one thing I want you to rehearse is the fact that that little verse from Proverbs, which says, anger rested in the bosom of a fool. And you can write that down, write it somewhere that every day you see it, so that every time you remember it, you're going to work on your anger problem. And of course, it's important that those around you are going to understand. And in a sense, we are all human beings. One of the quickest thing that you can do is, if somebody shout a burst of anger out of you, your in turn is going to retaliate, because that is how life is. But I'm going to challenge you to learn to, bear it and work with the individual, and you'll find that it works out very well. Now, from anger is going to generate stress. And I'm not going to give you a talk now and everything about you know, what stress can do to your body. Everybody knows about the complications that can arise, and such as I've mentioned one, high blood pressure. But if you are diabetic and you're getting angry and you're going to be stressed, then you are going to find that your diabetes is not going to be controlled properly. And that by itself going to follow a chain reaction of complications and events that are going to be happening to you. And again, if you are able to control this, if you are able to control the stress, then you are able to minimize the complication, and you'll be better able to get proper control of your health from that perspective. And the third thing I want to talk about, once there is that anger and that stress related thing, is the mental illness that generates from that itself. And as I told you, mild sort of stress gives you a little bit of anxiety. But if this is prolonged and it becomes pathological, then you are going to get pathological mental illness, which by itself is going to trigger another chain reaction of illnesses that is going to be troublesome for you. And that's what I'm going to leave there on anger, unless there is any question. And I'm glad for the person who sent that quote from the Bible and correct me. Thank you very much. Were you saying that it was from Ecclesiastic? I must be honest, I thought it was from Proverbs, but you are correct. No, I don't know if there are any questions as we move on, because I'm going to move on to the second phase of what I want to talk about. So I spend 15 minutes on anger and how I think you can deal with it. Are there any questions, or should I just proceed? And then we have the question and the discussion at the end. Let me know.
You may proceed, Doc.
All right. The next issue I want to talk about is some specific issues as it relates to men. And the first thing is, I want to talk about that little gland that sits at the neck of the bladder, called the prostate gland. And the truth is, it's a very important gland in terms of physiology and your well-being, in terms of, you know, your sexual function, etc., etc. But when it becomes a problem, it becomes a problem. And the truth is, as we get older, it's going to become a problem. But even the young age, the problem it can arise from that. It's like if it gets infected, you get prostatitis. And prostatitis is a difficult situation to address. And you know, it can be treated, but it tends to be recurrent. And a lot of the time it starts from some sort of infection of some sort. And the prostate gland, it's sometimes very hard to sterilize it. And once you have one bout of prostatitis, what you'll find happening is that even without a subsequent infection, you can get a flare-up, because there are certain types of food that will irritate the prostate and precipitate a prostatitis. And the type of food are like pepper, spicy food, curry, alcohol, and those sort of things can aggravate the prostate and brings on a bout of prostatitis. So that is important. Now, as you move up in age, there is a strong correlation now that depends, of course, on your genetics and predominantly your lifestyle. If you have a genetic predisposition to having that big, dreaded prostate cancer, then your lifestyle should be such that you want to minimize its presentation. And if you look at the literature, I remember in medical school, they used to give us a little guideline in how you look at the incidence or the risk of developing prostate cancer. And it really has to do predominantly with your age. So if you are age 50, your risk of developing is going to be very low. But well, anywhere from 40 going up. But as you increase in age, the risk is going to increase. So by the time you reach 70, your risk of developing prostate cancer is going to be about 70%, depending on your predisposition. At 80, your risk is going to be 80%. And at 90, your risk is going to be 90%. And if you live to 100%, from a theoretical perspective, your risk of developing prostate cancer is going to be 100% if you live long enough. Now, what does this mean? It means that as men, we have to watch our prostate health. And what do I mean by watching our prostate health? We want to eat properly because diet has a main contributor to it. And one of the main culprits that is incriminated in prostate cancer is going to be animal fat, high fat diet, but predominantly animal fat, meats, heavy metals, etc., ingestion, etc., etc. And what you want to do is to regulate your diet to minimize that risk. So once you have done that, you're going to do something about minimizing it. And one of the next important aspects is being able, you must have regular exercise. And this is not unique for prostate only. It's almost very important in every other aspect of any illness that one could have, that exercise is going to minimize it and help you to maintain better health. So it's very important that we are going to work within that aspect of it. And once you have done that, now you have cleared your path, you now need your proper screening. And depending on your family history, you might want to screen at an earlier age, but the average age that we are going to be started screening is somewhere about 50 years. Or if the family history is such that it came on at an earlier age, then you might want to start your screening at an earlier age. But the average is about 50. And what does this screening entail? It entails yearly. Yearly, you are going to have your prostate examination done. And along with that, we are going to do your PSA, which is a marker in the blood that we can measure, that can tell us what is happening. And we can also use ultrasound to assess it. So if you do a physical examination and men don't like to have that examination done, it's a culture in Jamaica, but it's important that that prostate is assessed from a digital examination along with ultrasound and along with your PSA. And that triple assessment will pick up any early changes that can be treated. And the good thing about picking up this early is it is, in fact, let's say that you should never say that you have cure for cancers. You should never say that. But if you pick up early prostate cancer that has not spread outside of that, and they have staging that they use when you do the biopsy, outside of that capsule, then you can have surgery where you remove the entire gland and you can literally get a cure from the disease. So it's absolutely important that we are going to monitor that aspect of our lifestyle in order to minimize any long-term or advanced presentation for prostate cancer. And in a nutshell, really, that's really what you need to do in order to maintain proper prostate health. Now, you hear a lot about the treatment modalities for this, and what it, will do to the meal, that sometimes is very, very frightening. But as I said before, if you catch it early enough, and nowadays there are 2 techniques that are used to remove the prostate. And you can do it laparoscopically, which is minimally invasive, or the gold standard, you use robotic resection. And the beauty about those 2 methods is that once you remove the gland, you can spare the nerves that are associated with potency, and the patient will not lose erectile function. If the old-fashioned method where you use open surgery and also pharmacologic agent, and also in advanced cases, sometimes remove the testes, all of those modalities are going to be associated with erectile dysfunction, and that can be very disturbing to the male. So I'm going to implore males, look at your prostate health, stay on top of it in order to pick up early diagnosis, so that you can be treated early and preserve your manhood, which is very, very important in your well-being. Now, as we get older, and every time I give this talk, I get this question asked. So I'm going to use the opportunity to answer the question right away. And our male population here in Jamaica, and I believe it must be the same everywhere, and there is a lot of emphasis on sexual function. And men want to know. In fact, if you want to become very wealthy, discover something that will enhance male sexual function, and that thing will sell like hot bread. Now, you must understand how your body functions. When you are in your teenage years, late teens, you're going to have high, strong sexual desire, strong sexual function, potency. Early 20s, it's going to be very strong. As you get down into the 30s, you're going to find that it's not so strong, but it's there still. You might not notice it. But getting up 40s, 50s, and 60s. I've had patients come to me at age 65, 70, and they'll tell you that, doctor, I am not able to get a reaction, an erection long enough and hard enough to engage in proper sexual function. And I would ask them, how long you think you should maintain an erection to have proper sexual function? And they said, doc, I want something that will keep me for about half an hour or an hour. The truth is, if you look at the physiology books, and I'm sure a lot of men on this listening now are going to laugh. If you look at the physiology book and your, I'm going to call it for now, your maintenance time, it runs somewhere between 3 to 5 minutes. So how are you asking for half an hour? So what you find they do is they'll go out and buy a lot of enhancing medication that will try to boost them. But what I want to tell you have to understand the aging process and how it relates to it. And to put this in perspective, if you are 65 and you are able to have sexual intercourse once per week, then you are very lucky. You should consider yourself happy and be satisfied with that, and not to use any enhancing drugs. The other thing that is important in order for you to maintain that as well is for you to maintain your very good health. And I alluded to some aspect of it before as it relates to high blood pressure. There are certain medication there that can affect that aspect of your life. And if you are diabetic can affect your vasculature and the nerves that are important and you might be compromised from that perspective. However, if you're able to maintain proper health as it relates to your blood pressure and diabetes, to maintain good control, then you'll minimize that risk. And that is how you do it, and not to, read false literature and to be fooled by certain pharmacologic agents out there that you're going to waste your money on, and it's not going to be doing you any good. So it's important that you look at yourself from that perspective. So if you look at the male, the commonest male cancer in Jamaica and everywhere in the world is prostate, followed by the lung, and the third one is going to be colon. So as men, we must look also at our health in terms of, we have mentioned the prostate, but you have to look at your health in terms of your lung as well. And again, lung cancer, not so very common, but it is there. And you, again, can do something about it. And as you know, one of the basic thing in Jamaica is that people who smoking is incriminated in lung cancer. So if you want to preserve your life where that is concerned, you have to minimize or stop smoking or never smoke at all, because once you have done that, your risk is going to be increased. The sad thing about lung cancer, though, from the clinical perspective, is that most of the time, by the time you present, it's very late. When you are starting to having the symptoms such as that chronic cough, that productive cough that is bloody, and you start having weight loss, then it is far gone, and there's not much that can be done. You now have to resort to what we call palliative treatment, where we try to maintain you reasonable good health to give you a proper lifestyle as you battle this disease. The important thing is to catch it early, and if you catch it in its early stage, then you can resect the area of the lung surgically, and that will give you the best or the nearest to what a cure should be. And I want you to pay strict attention to that as well. Very, very important. And inhalation of, toxic fumes, toxic chemical, all of those predispose you. And I don't have to say much about that. You have seen what happened with noxious fume at Cornwall Regional Hospital. We had to lock down in order to maintain the health of our people, and predominantly of the male, who it's where it is the second incident there. The third cancer is one now that I want to spend a little time on this one for you, because it's very important. And and that's colon cancer. If somebody should ask you, is it possible to cure or to prevent colon cancer? And if I were to ask that question of you, I'm sure a lot of people will say, oh no. If you have the genetic predisposition, or you are going to probably get the disease. But I want to tell you that it is possible to prevent it, and it's possible to cure that disease. So the important lesson here is, how is that possible? That is possible because all colon cancer starts as a polyp. And if you are able to identify that polyp early, then you can remove the polyp and prevent the disease. If you have certain genetic predisposition, and one of them is familial adenomatous polyposis, you don't have to remember that. If someone has that, it's not very common, but if you have that, your risk of developing colon cancer is going to be 100%. So once you see that disease, what you do, remove the entire colon before it turns into cancer, and you prevent the disease. The other genetic predisposition, which is referred to as the HNPCC, which present at a later time in life, around about 40, 50 years old. If you have that predisposition, then you should start screening your colon to look for those early polyps at an early age. In fact, when I was in med school, everybody used to say you start screening at age 60. But that screening now has come right down now to age 45. And we are start screening at age 45 now for colon cancer. So it's very important. If you have a genetic predisposition, you're going to pay attention to your diet. And the diet which prevents that is going to be the diet that is rich in fiber. Like all of the nice fiber food that we have here, you know, pop, chow, callaloo, all of those things are healthy for your colon. And then what is bad for your colon is the fine food like that Kentucky Fried Chicken, that pizza, that Burger King. Fine food, refined food is not good. So if you have a predisposition, you want to move away from that food. And you're going to start your screening at age 45 so that your polyp can be found, your polyp can be removed, and you can prevent the disease. I don't want to go into a didactic lecture. I just want you to be able to know how you are going to prevent stuff. And these are the main one as it relates to men's health that I want to talk about. But if I were to summarize at this stage, you realize that a lot of these has to do with our lifestyle and how we eat and our lack of exercise, etc., etc. And I'm going to stop at this point. That's a lot I've been talking for the past. How many minutes that, Miss Gill? That's almost 50 minutes, and we open up now for questions and answers. Thank you.
Yes, thank you very much, Dr. Fray. That was very insightful. So we are opening for questions. I've also asked on the Facebook live chat, anyone has a question can post in the chat and I will pass on the question. So we are open up, guys, ladies and gents. Any questions? Seems like we have a very shy audience today.
Or probably they were not listening.
Well, I think they're shy.
I'm sure men have a lot of questions to ask.
Doctor, Harriet, just Carrie Brown Ellis here. Just
Sure.
one question. What I often observe is that you have some persons who, well, males who has high blood pressure, but they just don't want to take the medication because they say it's going to create a problem for them to get it up. Is that a must?
No, let me tell you, you see, once you have that mindset, you are going to get a cascade of events that come from that. So they are not going to take the medication because I think it's going to affect their sexual function. But I want to tell men there are high blood pressure tablets that does not affect your sexual function. So that's the first thing you have to do. Now, if you don't control your blood pressure, you're still going to lose sexual function because it's going to gradually damage the vessel. And how erection works, you know, it's a nerve impulse that allows more blood to flow into the tissues of the penis to give you stiffness. And if the vessels are affected and you can't get that amount of blood into the corpora cavernosa of that penis, that's the name for it, then you're not going to have that strong erection that you want. So either way, you're going to lose it. So what I would tell the men is talk to your doctor and say, look, I don't want a medication that will affect my sexual potency for my blood pressure. And as I said, there are lots of other medication that you can use to control the blood pressure that allows you to maintain your sexual function. So that's very important.
So,
Thanks.
so Doc, what about the persons out there who would say that natural medicine is better than going to the, because a lot of men we
All
find
right.
don't
In
want to
fact,
go to the
yes,
doctor.
yes. In fact, that's a good question. And I'll be honest with you. I'm one of those persons who will say to the patient, look, I want you to take the medication that is prescribed. And whatever natural, in fact, blood pressure, the greatest drug for, the greatest treatment for it. I don't know if you know, is patient tell you, oh, I'll eat a clove of garlic. I don't know if nothing wrong with taking a clove of garlic. And if that drops the pressure somewhat for you, but it's a subjective thing because when you take the garlic, who's measuring your blood pressure? So I would tell them, so look, take the medication and take whatever herbs or medication that you think that can help. And I call it adjunctive treatment. Then that is useful as well. And it's not only for blood pressure, you know. You have seen this in almost every illness. I've seen a diabetic lady who present with almost wet gangrene at the leg. And I say, how can this be? And she tell me that her neighbor told her to stop taking the insulin and gave her some bush to take. And she was taking it for 4 weeks. And our sugar went sky high. She got an infection and she lost her limb. And a lot of people, you know, will do things like this. It's like our culture that, you know, and you see it a lot in cancer care as well. I mean, that's another big issue where people move from the standard conventional treatment and they will move to some sort of herbal medicine that probably have some benefit, but not the benefit that you want to achieve in also in order to control the disease process.
Thank you, Doc. Another thing that I've heard out there some time ago regarding COVID is that some men were um, a bit skeptical about taking the vaccine because it was said that it would affect their ability to get it up. Is that what is that about?
In fact, I've heard that, and I've had intelligent patients. In fact, not a lay person come and tell me that. So, you know, I use the opportunity to research it, and I have not found anything that correlates the vaccine to loss of potency. And I've read a lot on this thing, and I've not come across it. So if anybody can give me proper documentation, proper study, and if you think about when we started the vaccine, I don't know if we could have any proper study in order to look at that. But I haven't met any patient who have had the vaccine who tell me that they have lost potency. So I would leave it at that for now.
Okay. Any other questions from our audience?
Yes, good afternoon, everyone. Thanks, Dr. Fray, for a beautiful talk. Always a pleasure hearing you, Doc. I have a quick question, though. I remember attending a Jamaica Urological Society symposium just before the start of COVID. And one of the new ideas that they were presenting was that men who have sex very frequently do tend to have lowered risk of prostate cancer. Is this really a thing, Doc?
In fact, that's a very good question. You know, I've heard it documented by, you know, urologists. So I have to believe it. I have to believe it. But, you know, when I saw that, I was as surprised as you are. Mr. Spears. Yes, I heard that as well. I can't substantiate it, but it seemed to be true.
Okay, noted that. And another thing that they had mentioned was that lycopene, which commonly is found in tomato, which would have been said to be beneficial for prostate health, has been found not to be as beneficial as one thought in reducing the risk of prostate cancer. What are your thoughts on that as well?
In fact, you put it very nicely. You said the risk is not as strong as it used to be. And in fact, you see when you do studies, the lycopenes, they have found that it is not so protective as they should have been, but it still gives some protection. And I don't think you can go wrong by eating your tomato.
Okay, noted that. Thank you so much.
Okay, Dr. Fray, there's a question on Facebook. One of our audience is asking, can prostate problems be directed at age 30?
Oh, yes, it can. In fact, I'm trying to remember the youngest patient I saw with prostate cancer. Oh, he was 42 years old. But that's very atypical. And he had a strong family history. There are certain genes that predispose you to cancer early, and you have to look out for those. But at 30, you can have other prostate issue. I mentioned it. You could have prostatitis. You can have, like if you have an injury, you can damage your urethra, you can get stricture, etc., etc. So other things can happen that can affect, the whole outflow from in terms of urination and the prostate as well. Dr. Johnson Campbell made a note, which I hope everybody see, that frequent sex, you have to be safe about it, because that comes with other problems as well. Mm-hmm. So you have to be responsible and safe, and we want to reinforce that point as well.
One last question from me, Dr. Fray. I've always heard this while growing up, that men aren't supposed to use black pepper because it can cause blockages for them as they develop prostate.
No, there is no evidence to support that. And let me tell you why. When you eat black pepper, it's not going to be excreted. Well, the solid pepper is not going to be out in your urine causing blockage. It's going to go in your GI tract and it's going to be absorbed. There's no way it can block anything. So that's just a myth.
Oh my God. Thanks for clearing that one up.
But if you're prone to prostatitis and you eat black pepper, it can flare up the prostatitis. As I mentioned, things like curry, things like pepper, of course, ginger, those things can flare up prostatitis, but it's not going to cause blockage of such.
Okay, thank you.
Wouldn't that come in hand though, Doc, with the whole spicy food, and because black pepper is classified as spicy, is it not? So the whole spicy food triggering whatever it triggers to cause the cancer.
No. It's not going to cause blockage or cancer itself, What it does, as I said, it flares up prostatitis if you have it. Now, suppose a man never had an infection. That is not going to do anything to him. And there are some people there are some culture that they eat a lot of pepper. And I don't see any evidence that prostate cancer has increased in that jurisdiction. But I could be wrong, but but I'm not aware of it. It might very well be there, but I'm not aware of it.
Okay. Another question on Facebook. The question is, what are the signs and symptoms of some prostatitis?
Oh, the main issue there is In fact, the patient complains of the discomfort in its early stage, just at about the base of the pedis or in what we call that suprapubic area. And they will tell you that they have, when they pass urine, it's associated with some amount of burning. And when it becomes florid, the whole area down there becomes inflamed. And when you examine them, you can identify it. You don't want to reach that stage. And then you have to make sure that you give them strong antibiotic in order to resolve it. And sometimes you have to give them prolonged treatment with anti-inflammatory drugs, so non-steroidal anti-inflammatory drugs, to decrease the inflammation that is associated with that. Because you remember, the prostate sits right at the bladder neck, and the urethra runs right through there. So any activity in terms of urination, when that gland is inflamed, is going to present itself to you. And if it's really bad that there is pus associated with it, you're going to see turbid urine, dysuria, that sort of thing. And then that is really bad.
Doc, I know you're winding down now, but these are some myths. I don't even know if I want to call them myths, but like I said, growing up, you keep hearing stuff. So another thing that I would have off my hair is that Jamaican men are prone to prostate cancer because of ackee, because they eat a lot of ackee, and ackee has in stuff that contributes to the cancer. Is there any truth to this?
In fact, there was a time when there was an article out of the US which was incriminating ackee. But I heard a urologist from university who did proper research on it, and there was no evidence to support it. So I have to go with that evidence. So I would call that a myth.
Okay, all right, thanks.
Okay, Dr. Fray.
Yes.
Does men that cycle, does it have any relationship to early erectile dysfunction?
All right.
Cycles frequency?
Yeah, that's a very good question. And there have been documentation. Because when you sit at that cycle seat, as you ride, what you're doing is massaging that prostate, and you're going a long run. And there's some correlation that they can have some prostate issue associated with that. But the specific of what that is, I wouldn't be able to tell you. I would have to look at the research. But the answer is yes. Men who cycle can present with some prostate issue. And it has to do with just the physical aspect of the cycling itself. Massaging that prostate as you ride along.
Thank you, Doc.
Okay, any other questions? Okay, seems like we have no further questions. I want to use this opportunity to let our audience know that the staff welfare unit, in collaboration with the technical team, will be embarking on an initiative to bring some testing for men, such as blood pressure, sugar testing, and some other testing. We are taking that throughout the parishes to the different locations. As soon as that comes on board, you will hear more information on that, but just look out for that, because we want to take care of our men. We realize that sometimes we just have to bring the service to them, Dr. Fray. So we will be embarking on that.
They are usually afraid. Try do a rectal examination and a meal, and you'll see something.
Okay, so that will be coming on stream very soon, so look out for that. And I hope that all the men on this platform will take it up and, get involved, get your checks done, so that you can be better informed on where you stand medically. All right, so if there are no further questions, comments, Dr. Fray, I want to thank you very much for engaging us in this very interesting presentation. We learned a lot today, and certainly, you know, some things we can take back to helping our colleagues, brothers, family members, etc. So we really thank you for coming to us, talking to us, Men's Talk. We really learned a lot. Thank you for the men that joined on today and all our regular audience members. Thank you very much for joining. And we want you to join us again next week. Any final words, Dr. Fray, before we go?
Well, as I've said before, our health is in our hands. And I would implore everyone that a healthy lifestyle involves proper eating habits, exercise, adequate rest, ensure adequate fluid intake, and you can minimize a lot of disease processes. And if you do have them, by doing so, you're able to control them properly and live a much longer and healthy life.
Thank you very much. There you have it, folks. Take this information, and the good Bible says, those who have an ear to ear, let them hear. So thank you everyone for joining. We are officially ended, Dr. Fray.
Okay, you're most welcome. Thank you.
Thank you very much. Thank you, everyone. Enjoy the rest of your evening and have a safe night. Thanks for coming, everyone.
Thanks so much, Doc. Lovely program. And, you know, we're going to invite you back again, but I'll give you some time now. And we can come again, but you definitely will be needed again. So thanks so much for coming.
Yes.
Okay, bye.
All right. Thanks, everyone. You have a good evening now.